And we told you we're celebrating our frontline workers. And please, it doesn't only have to be a nurse or a doctor, because there are many people on the front line who are working. We have the security service personnel, we have members of the ambulance team or ambulance service, we even have wardens at the hospitals, those who are dispatch riders, and those who even work at the research institutions or in academia or the ministries. They are making sure that all of us are doing what we have to do perfectly and keeping our environment and our society as safe as it could be, so that we're able to reduce the number of infections when it comes to coronavirus. And that is where we have to go first to the National Ambulance Service, where we have the Deputy Director for M&E National Ambulance Service, Mr. Yao Sai, and he's on the line. Good morning to you, sir. Good morning to you.
Good morning, Roland. How are you?
I'm fine. I'm fine. We also have the UGMC team with Dr. Daniel Soti as the lead, also on stream, and I can see a couple of nurses as well as other professionals who work with Dr. Soti in there. And Dr. Soti, can you do the introduction for us as well?
Yes. Dr. Daniel Soti, specialist on duty here. Dr. Abalos. Can you give a wave, Dr. Abalos? And yes, that's Dr. Abalos. And then we have Dr. Emma Adai also here. And then Dr. Nanadjo Asumitiwa also here.
Yeah. Hi. Okay, we want to celebrate all of you. Indeed, we're celebrating many other workers, and even after talking to you, we'll still go onto the streams and speak to you. And let's start with you, Dr. Soti, and the rest of Abba and all of you there. Now, I would want the ladies to speak first, so if it's possible, because I love the ladies also being put at the forefront, because then it says as the example as it is. But what sometimes are some of the emotional turmoils that you have to go through each day when you want to get yourself ready for work? Let me start with, it could be anybody, about any of them.
So, you know, it's like you said rightly, it's an emotional turmoil to get up in the morning and, you know that you are leaving your family, going out into the field to expose yourself more or less, to put, yourself at risk. But it's your job, and it's, what you have to do, and you have a passion for it. So you put up a brave face and take precautions, and you go and do what you need to do.
And then I have to ask you, Doctor, who is sitting next to you, Doctor?
This is Dr. Adai.
Okay, Dr. Adai. Now, Dr. Adai, I've read many reports internationally about medical doctors, professionals, researchers, ex-nurses who sometimes have committed suicide or have just taken their life because the situation is just unbearable. In such instances, when you know that you can relate to such situations, the clinical situations, how does that make you feel? How even do you communicate that to those around you, your family, etc., for them to be in tandem in understanding?
Well, that's a tough one. I mean, it's always hard to read or hear about colleagues around the world getting to that point where they take their own lives. But as Dr. Abba said, you simply take each day, like you take it one day at a time. That's about all you can do. You take each day at a time, take each day as a new day with new challenges, and try to handle things one day at a time, because the challenge comes when you keep on the stress, when you add on all the emotional trauma and everything that you are seeing, and then it becomes a lot on you and you cannot deal with it. So you try that by the close of each day, you try and just go to bed, wake up the next morning and just tell yourself, this is a new day. When you are in war, there are battles, but there's the war, and you cannot let one battle prevent you from going through the rest of the war. Another thing we do is we encourage each other a lot. We support each other. We depend on each other. So we talk to each other when we have challenges. And then we encourage each other. As we say, it's teamwork.
Yeah.
So on days down, you can talk to a colleague, tell them what you are going through, they understand. And then our family support systems too are very crucial, not just family, all our support systems, church, other groups. So a word of encouragement from time to time, a prayer here and there, and things like this that you are doing for us, they go a long way to push us, to support us, to know that somebody's got our backs. For me personally, prayer is also very key. Our relatives, when they hear of these things, of course, people get scared. Then they call you and say, hey, we heard a doctor or a nurse here committed suicide or did this. And then naturally they are concerned. But what we can do is to reassure them and tell them that we are taking things one day at a time. And we believe that we'll sail through this. You have to have a lot of faith.
Yeah, yeah. Okay, so this is what we're doing here at the Multimedia Group. We're 25 years today, and we want to celebrate not only all those who have passed through this great institution, but just to signify the first time that we had Joy FM, which was the initial subsidiary that went on air. But before we do that, I'll be in a minute. I would want the ambulance team to introduce themselves. I see 3 of them before we go do the countdown quickly as possible. Ambulance team, can you do that? Who is leading and who are the others supporting? Yeah, just mention your names quickly and then we do a clap. And then let's see. Okay. Okay, so we're clapping for all of you. Clap for yourselves as well. Thank you for the good work you're doing. God bless all of you, Dr. Anna, Dr. Soti, Dr. Adai, all of you out there who say that the great work you're doing is worth it. It's worth it for Mother God. Yeah. I just can't stop.
Yes, so we celebrate you today on this special day. You are working, doing all the hard work. Roland, you are going to talk to the ambulance service and find out how it's been like for them. So let's focus on the ambulance service now. You did your initial introduction.
Thank you.
Really appreciate giving us this opportunity to celebrate it. I also congratulate you for 25 years. Family and paramedics, this has been our core duty, so we always wake up with the enthusiasm to come out and also to do our work. We've been in this fight together from day one, and we are still there doing it. Our team are dedicated who are going up and down every day, 24/7, to be able to save life each and every day. And we appreciate them. We want to use the opportunity to also thank all communities all over the country for the good work that they are doing. Let's do this together. And tomorrow we will celebrate it beyond this platform. We really appreciate your kindness.
Are you the guys who do the transportation of the samples? I'm very curious to know.
No, we're not the transportation of sample. We just do transportation of affected, confirmed or suspected patients in treatment centers.
Now, knowing that you have families and they know that you're on the front line, how do they react to you after a day's work when you're able to get home?
Now we go and our families are praying with it. They are sometimes saying that, hey, are you guys here? And we tell them that, yeah, our management took us through training, so we are prepared. And from day one, we've been going out there doing education, our work. Fortunately for us, none of our staff frontline members have been exposed
Now we have also joining us on stream, and one of our own supporters with Elegant Homes, who also wants to encourage and appreciate them. Dorothy Kwashi is the Executive Director for Elegant Homes. She's also on stream. Auntie Doris, we say that for all the things that you do, congratulations to you for great work also being done, Dorothy.
Thank you.
Okay. Now, let me go back to my UGMC experts. Now, before I come to Dorothy, who has just taken a seat?
It's Lodina.
Lodina.
Okay, it's Lodina.
Lodina. A critical care nurse.
Yes.
So, on a normal day, what's your work like within this period?
Well, currently, here are for our shifts. And depending on the needs of our patients, we go in averaging twice per shift. And you will spend between 2 to 4 hours inside the ICU, depending on what our patients' needs are like.
There's always the opportunity for you to know that you can always excel at what you do. But knowing that this is a time where each encounter of a case puts you closer to an unknown plane or place, what goes to your mind each day when you're treating such patients?
Well, I would say that we've been well trained for things like this, though we haven't had a pandemic of this kind in our part of the world before. Rely on the skills I've been taught over the years, and I do as I've been taught, and to the best of my ability. Yeah.
Okay. Now we have Mrs. Dorothy Kwashi. She is Executive Director for Elegant Homes, also joining us on Zoom. She would want to say some words of encouragement to you, and also have to add, if she gets to appeal to you to buy some of her homes, it won't be bad. Elegant Homes, I've seen their drawings and their sites. They're very beautiful. So, Dorothy, please, you have the space. You can say all the encouraging words to our frontline workers we have on stream, on Zoom.
Hello, good morning, Roland. And I want to say to our frontliners that Elegant Homes appreciates their hard work. To all our doctors, our nurses, our paramedics, our lab technicians, to our cleaners, our security agencies, the media, and to everyone out there for your sacrifices, contributions, and working tirelessly around the clock fighting COVID-19. We say a very big thank you. One Dynasty.
Thank you, Dorothy Kwashi. Mrs. Dorothy Kwashi is Executive Director.
And just in case you need houses from Elegant Frontliners, a special discount for the great work that we are doing for Madagascar. God bless you all.
Well, yeah, I've seen Dr. Adai there clapping. Dr. Adai, what are you clapping for?
Details of the discount. I'm grateful to her for the special discount she mentioned.
Yeah.
I think I'm clapping on behalf of all of us, all the health workers, the paramedics. I think we're all happy about the special discount. Yeah.
Charlie, but seriously, you guys need to ask of the prices, so the way you're clapping. The way you're clapping and knowing how.
I should take you to our call.
All right. And knowing how nurses are paid, Charlie, acts of the prices. But Auntie Dorothy, we thank you so much for the help and the discount pricing scheme that you have specially designed for the frontline workers. And Abdullah is among the team of men of the ambulance service. And Abdullah, let me ask you, you're supposed to be a Muslim, or are you a Muslim? So you're fasting, aren't you?
I am.
Okay, great. Yeah. Now, what usually are your special prayer mentions to Allah within this period?
With this period, our prayer is God to save us from this and take these diseases away from us. This is the first time we are facing such a pandemic, and it's wow. When we are praying that may Allah save us from this, take it away from us, and let's live our normal life. That's our prayers. We do almost all Muslims, including the chief imam, that the prayers is this pandemic should move away from us and all over the world.
Have you been transporting some COVID cases?
Very, very, very. We almost, I can't actually give you a number, but we transported a lot. Almost getting to 600 to the various isolation centers.
Hey, then
yes.
Then for your paramedics, can I speak to a paramedic?
Before you do that,
we are all paramedics.
Okay, great.
But I have a curious question as you're fasting, because this is the fasting period. So how are you managing the fasting and your regular work?
Yeah, with the fasting, the job has come, and you can't run away from it because you are going to fast. I'm fasting whilst I'm doing this job. So I can't run away from it. I'm called to duty, and I must perform to my perfection. Yes.
Great. Well,
so when you are in the vehicle and you're transporting a COVID case, of course you've been trained, but of course you're human. Your human side, which one comes out?
I think Officer Nat will answer that question for me.
Please, Officer Nat, get straight away close to the mic.
Okay, can you hear me?
Sharp.
Good. Even though we are trained, sometimes you can panic, but you always tell yourself that, man, I can do it. I have to do it for God and country. If I don't save these people, they'll go out there and infect a lot more. And it can't get to my family. So I have to do what I can do, keep myself safe, keep my patients safe, send my patient to the isolation centers, and then ensure that they are taken care of. Yes.
Now let me go to my UGMC professionals, and I'll go to Dr. Adai. Dr. Adai is there. Dr. Adai, I can see here, right? I think I'm taking you with Dr. Adai, so sorry about that. But Dr. Adai, I know that for many of you, immediately you get into that big yard, you don't come out until your shift is over. Is that not it? And by the time,
that's right.
And by the time you get home, you're tired. Okay. You're emotionally stressed.
Okay.
Okay. Now, we are those who go out there. We know what is in town. Sometimes people don't wear the masks. They don't go according to the protocols, washing hands quickly. They congregate in numbers that they are not supposed to. And we see all that we show to you by way of content in the news. When you hear of these things and you are closer to the cases at the hospital, how do you feel about it?
So this is something we talk about every day. As you said, we are most of the time busy working on the patients. We are not able to, at the same time, go out and educate people. So we are grateful to you, the media, and all who are making that extra effort to educate people. And it's sad for us when we hear stories like people still don't believe the virus is around, or people are too relaxed and do not want to adhere to their precautions. I mean, we wish we could stop work and go around and shake everybody to know that this is real, but we can't do that because we have to take care of the patients. So now that we have this platform, we want to that this is real. We come to work every single day because of this, and we see what we see is what we see. Nobody there is making any of this up. So we are serious when we say to the nation that everybody should adhere to their safety precautions. And you see, these are things that are not out of our reach. Hand washing with soap and running water, wearing the face mask, and the social distancing that most people struggle to do. These are not normal times. We understand that this is not something we are all used to. Health workers. It's not normal times. But if we want this to go so that our lives can get back to normal, then we all have to adhere to the safety precautions. Because if we adhere to it and others do not, then the chain is broken and we'll still all get infected. You see? So we are each other's keeper. As you said, we also hammer on it to everybody. Please, we appeal to you. This work is not easy. These times are not easy for everybody, for us here and for you at home. And we do not want this to get out of hand. We do not want it to get to the levels we are seeing in other countries. We want to get rid of this virus and get rid of it now. And for that to happen, we need each and every one of us to play our part. You understand? Nobody can wash their hands and wash your hands for you. So you have to do it yourself. So let's take every opportunity we get to encourage anybody in a small area or a small circle, or anybody who will listen. Let's drum it in till it's like a rhyme, till it's part of us, and it comes to stay. Very, very simple things. We are not asking you to do anything too advanced. So please, people, take this serious. We beg you. We are not happy to see anybody die. We are not happy to see the virus affect families and affect the nation. We've all seen how the economy is going. We've seen the effects. So many things have come to a standstill. And like you at home, we all want to get back to life as normal. There are so many things we also do. So please, let's wash our hands. Let's turn over a new leaf today. For those who have not been listening, we beg you, if you won't do it for yourself, do it for anybody you care about. So that at the end of the day, we will all win this battle together.
Great, yeah. Can I also hear from your nurse? And I want to find out how, as a nursing team, your entire lives have changed, and the routine, even in the hospital, around this time. So, in like about a minute, can you take us through what has changed in your routine?
Hi, I'm Chris, and I'm a critical care nurse. So, aside the fact that we are doing extra hours and then extra duties, because if you enter as a nurse, you are not just going to do normal nursing duties. You are going to clean the floor. You are going to do things that are not necessarily in your practice. And then aside the fact that you go home, you are not able to share quality times with your families, and a lot has really changed. A lot has really changed. You go home, you can't do the normal things that you used to do. You can't go to places that you used. Your neighbors are running away from you. They call you to greet you, but they don't want you to visit them as you normally do. A lot has changed.
And how? And just that bit that you described in terms of the reaction, how does it make you feel, knowing that what you're doing really is to save our lives, and that's how we treat you?
I think it's more about education. So I just use the opportunity to educate them that me visiting them or they visiting me wouldn't make them get the disease. But if we adhere to the precautions, we all be safe. For me personally, I think it's fear for them. So I don't really hold it against them. I just try to educate them.
Okay. All right. Listen, we know the incredible things that you're doing, the many things that naturally should not be your core duties, but you're breaking your backs and you're doing this. We can't pay you enough. I mean, we can't give you cash. But we want you to know that we appreciate your effort. We acknowledge what you're doing. We see it, and we want to share your stories with the rest of the world. So on behalf of everybody at the Multimedia Group, all of us, and I guess our viewers as well, we thank you. And once more, we want to clap for you. The ambulance service as well, this also goes out to you. Thank you for joining us here on our show today. We love you. We love you.
Very grateful.
All right, so that's the team there that we've spoken to, and we do this on behalf of all of you watching as well. Let them know if you know any worker, anybody who is on the front line right now who is doing work and the person is your neighbor. Please reach out to them, send them messages, show them love, because what they do is not something that anybody at all could do. They've been trained to do some other things, but they're going the extra mile.